Varicella is a highly contagious disease also known as the chickenpox. It is caused by varicella zoster virus, which is a DNA virus that is a member of the herpesvirus group. Herpesvirus, which cause the chickenpox, commonly affecting the children and young adults and single in adults. Chickenpox infection are specific in the human. Chickenpox is an acute infection disease and primary infection in non-immune hosts. After primary infection, it is the time for varicella spread to the mucosa and epidermal lesion to the local sensory nerve. This is the disease spread easily in the children and pregnant women. Even adults develop chickenpox, the illness may be more severe. The chickenpox stays in the body in the sensory nerve ganglia as the latent infection. As mentioned, the herpesvirus consists of two phases. During the latent state, this virus remains inactive, but it can be reactivated in the later state when the activate replication is occurring. A vaccine for the chickenpox is available for those who are unvaccinated, are more susceptible to contracting this disease. The children are higher risk of getting chickenpox than the other. The signs and symptoms of chickenpox are fever, loss of appetite, headache, itchy, blister like a rash, tiredness, and general feeling of being unwell. The blisters are most often first seen on the face, middle of the body, or scalp. After a day or two, the blisters become closely and then scalp. Meanwhile, new blisters formed in the roof. They often appear in the mouth or on the eyelid.
As Quinn mentioned, chickenpox is highly contagious. Its mode of transmission is airborne. It travels through the air in small respiratory droplets. The other mode of transmission is physical contact. The virus is commonly spread through close contact with someone who is infected. A person who contracts the virus can be contagious as early as 1 to 2 days before the appearance of a rash and remains until the lesions are crusted. However, vaccinated people may develop lesions that do not crust. These people are considered contagious until no new lesions have appeared for 24 hours. The incubation period is 10 to 21 days.
The best way to prevent chickenpox is to make sure to get vaccinations. Here in the U.S., the vaccines in use and that are approved are Verivax and ProQuad. Everyone is able to get it, however, depending on your age will determine which vaccination you should receive. In the dental office, if a patient does present with chickenpox, the best things to do is to postpone the appointment to protect patients and staff from further exposure to the virus. It would be best for the patient to come back in 10 to 14 days or however long it may take for them to get back to a normal health status. This is why a comprehensive medical history is necessary for each patient that comes, because as a dental professional, you are making sure to be observant and notice any lesions that might raise some questions. For healthcare professionals specifically, an extra step for prevention is making sure to keep up with standard precautions, following proper hand hygiene, and using PPEs and so forth to help further prevent the spread of infections during appointments. Oral manifestation in the oral cavity usually looks different compared to chickenpox on the rest of the body. Sores on the body usually crust over after the blister stage, but crusting does not occur in the mouth. As you can see in these images, the lesions can appear as raised bumps and then can turn into shallow ulcers. This will usually vary person to person and if an individual is vaccinated or not. Chickenpox within the mouth tends to not be painful, but some individuals do experience discomfort quite often. There are a few occasions when it can be severe, especially if unvaccinated. The pain and lesions are more enhanced. If you happen to experience any of these implications, it is advised to seek medical attention.
As mentioned, the best way to prevent contracting chickenpox is getting vaccinated. The vaccine is given in 2 doses. The first dose is recommended between 12 and 15 months old. The second dose is recommended between 4 and 6 years old. The vaccine is proven to be 90% effective at preventing the disease. Once virus is contracted, your healthcare provider will implement one or more treatment options, such as medication, antipyretic, used to reduce fever, antiviral, used to control viral replication, antihistamine, used to reduce itching. Some self-care you can do from home during recovery is getting rest, using soothing lotions such as calamine, a cool bath with added baking soda and uncooked oatmeal to reduce itching. Over-the-counter drugs should not be used to reduce fever. This can lead to child developing Reyes syndrome. This is a disease that affects the liver and brain. As we can see on the provided table, the unvaccinated population have a higher infection rate. Next is the partially vaccinated, those who only received 1 dose. And the fully vaccinated, those who received 2 doses, have a lowest infection rate.
Chickenpox is a contagious illness caused by the varicella zoster virus. The best way to avoid getting the chickenpox is to get vaccinated and further take steps to reduce exposure to other individuals. Dental professionals should continue to follow the infection control guidelines to reduce transmission. When we determine the patient presents with a symptom of varicella, it is the best postponed for 10 to 14 days.